Let's start with this message. This episode will contain frank discussion about suicide, which could be triggering for some. If you've had thoughts about suicide or are struggling, feeling very overwhelmed, please call or text 988. My name is Kevin Frankish. Welcome to the Mental Health Podcast. If you're new to the program, I always end every episode with this statement: take care of yourself and take care of each other. Now, this reminds you of two things. First of all, when it comes to mental health, especially, you need to take care of yourself. Be gentle with yourself. Second, take care of each other. A reminder that we always should let others know they're not alone. For years, when it came to suicide, we sure didn't seem to do all of this. In fact, just uttering the word was taboo. Now, this came from a place of concern, not to say suicide, because apparently we didn't want to give anyone ideas. We didn't want to further traumatize family and friends left behind. This was, it turns out, wrong, according to the research. All this did was further isolate those with thoughts of taking their own life. They were alone. The best way to save someone's life, it turns out, is to shine the light into this very dark place. Talk about it. Directly ask someone about it. My guest is Dr. Allison Crawford, the Chief Medical Officer for the 988 Suicide Crisis Helpline. 988, a direct line to hope, right now on the Mental Health Podcast. Hello, Dr. Crawford. Welcome to the program.
Hi, great to be here.
So let's talk about 988, but let's also talk about the environment we're in right now and our changing attitudes towards the S word, the word that we were never allowed to say before, and that's suicide. And it is very much a changing environment. In fact, it was illegal in Canada until 1972 to even attempt to take your own life.
Right. And I feel some of the attitudes around that contribute to stigma. It's shifted a lot, but some of those really persist. And I think people can be very afraid to talk openly about suicide. And that's one of the things that 988 is all about, is making sure there is a place you can talk about suicide. There is a place you can go to. And we encourage people to be aware of that as a resource and to make people feel comfortable supporting each other and talking about suicide.
Yeah, we have so much to uncover and unpack here right now about your service and about the current environment. We are now in a time when the second leading cause of death in young people is suicide. And it boggles the mind. So much so that I know the University of Toronto just a few years ago had to sort of re-engineer a building to put up barriers because of an uptick in the number of people who had sadly taken their own lives. So it's an environment, it's a world right now where especially young people are feeling this pressure.
Yes, and that gives us all reason to take action. We know that mental health distress in general has increased over the last 10 years. And of course, in relation to COVID, that also seems to have been a factor, particularly for young people whose lives were very disrupted. And we need a whole host of different ways of responding to that. And 988 is one of those resources.
So let's first of all talk some language here, if we could. And now that I know what not to say and what to say, I cringe every time I hear someone say such and such committed suicide. And
Right.
this is a huge change. And you may think, oh, it's just semantics. Don't worry about that. But this is a very important distinction to say not committed suicide, but died by suicide. Why?
Yes. Well, and linking that back to what you were saying earlier about when this used to be when suicide was a criminal offense, committed has all of those criminal connotations and really contributes to stigma. When we say someone died by suicide, it's a more respectful way of speaking about it, but also what we know, and there's a lot of evidence now to back it up, that the way we talk socially about mental health, including about suicide, can really have an impact on whether people seek support, how they feel about themselves, and whether we view people in a resilient way that will contribute to their well-being. So it has an actual impact. It's not just about being, I mean, we should be aware, we should be sensitive, but it's not just about being that way for its own sake, for being politically correct. It actually influences people's mental health outcomes.
And sadly, this is not something unusual. This is something that happens, in fact, every day. And the latest stats that we have show that was it on average once every 2 hours, someone takes their own life. So this is a reality.
It is. And I think, we'll often hear things broken out different ways, how many per year, how many per hour. And I think it's like different people relate to statistics differently, and trying to help people to understand the immediacy, the magnitude of this as a social concern, rather than just as a number, because behind every single one of those numbers is a real tragedy, and one that can be prevented, or at least there's a lot we can do to prevent suicide and to support people.
Yeah, and you're so right as well. These are, we look at trends, we look at stats. I know in your job as well, you have to look at a lot of statistics and that, but we have to remember that each and every person is an individual with an individual story, with individual concerns and individual needs. There may be people listening and watching us right now who may have suicidal ideations, and I hope they get something out of my conversation with you. First and foremost is talk about it. Conversation, from everything that I've looked at, conversation seems to be the number one tool we have to try and cut down on suicide.
Absolutely. It's a very relational thing, because often when people are struggling with thoughts about whether they want to live or die, it's really about suffering and wanting to find a way to end suffering. And connection with someone else is one of the things that can really help people to feel more hopeful, and to feel that there are alternatives, to feel that they're not alone. And so it's conversation, yes, maybe to get people support and help, but also to let them know that you're there, and that you care about them, and that they have worth and value.
Yeah, you just said something really heavy there, that someone is deciding whether to live or die. That is extremely profound.
Yes. Yeah. And that's what our responders on 988, who come from all different aspects of life and who live across the country, a very diverse group of people, that's what they are there to do every day. They are there to listen without judgment, and to provide that space when people are facing those very difficult struggles. But we can all be there, not just on 988.
Yeah, I mean, this is important too, to get the message across. Listen, if you're concerned about someone, you can also call 988.
Yes.
How do you know that you should be concerned?
Well, I think anytime it comes into your mind that you have a concern, that you want to talk through with someone. So, and just for listeners who may not be aware, so 988 Suicide Crisis Helpline is the 3-digit number to access support, either for yourself or for someone else. If someone is struggling with thoughts of not wanting to live or with suicidality. And there's no wrong door to 988. If you are concerned, if you're struggling, and what people sometimes don't know, which is what you're talking about, if you're worried about someone else, and that's just, you want to talk it through with someone, how to be a listening ear, or you want to know about resources, or you want to try to connect that other person with 988, there are many reasons to call or text 988. And it's available 24/7. People should not hesitate to reach out.
As I said off the beginning, that at the end of the show, I always say, take care of yourself and take care of each other. And it's extremely true with this, that we have to, first of all, be very gentle with ourselves. And we have to realize that having suicidal ideations is something that we should be concerned about. And if we were all of a sudden bleeding for no particular reason, we would go to an emergency room. We would go see our doctor. But for some reason, when we have a serious mental health issue, especially when it comes to suicidal ideations, our first thought isn't to maybe seek out help. We get that tunnel vision that we're all alone. We're the only ones who have these problems. And sometimes all someone needs is just an ear.
Absolutely. And that's why we also say, don't wait. You don't have to wait. We are a crisis
Until it gets
service.
really bad.
Wait until it gets so bad. Yes, absolutely. And sometimes we don't know. I mean, that's part of the irony, even that to struggle with suicidality is to feel that you don't have options, is to feel like that's a very common element of suicidal thinking, is to think that there are no solutions, no options, no way out of a problem. But there are people who are there to listen and to support you to get the help that you need, including 988.
What kind of reactions do you get from callers? Are they surprised? Are they shocked that someone else cares or gets it? Or maybe they realize that there are other solutions? What kind of reaction do you get?
Yeah, well, we're very fortunate. We have had a lot of access to the service, so we know that people are reaching out. So there is a degree of trust there. When you reach out to a crisis line, that is a lot of trust that you're placing in that crisis line. And we're really fortunate to hear back from many people who have called or texted, and we're also starting to look at that more formally. So we have an opportunity for people to give their feedback right after they text in, and soon they'll be able to do that with the phone as well. And overwhelmingly, the response to 988 has been very positive. People feel supported. They feel like they would use the service again. And when they don't have a good experience, we want to hear that too. And of course, we respond to every comment that we receive.
You've had more than 500,000 calls.
That's right. Calls and texts combined.
So to me, that says conceivably you've helped to save or change 500,000 lives, maybe even more, because when we talk about someone who dies by suicide, they leave behind dozens, sometimes hundreds of people who are left asking the question, why?
Yes, absolutely. We now, and that's also been, confirmed through research. It used to be said that, for every person who dies by suicide, 6 people are affected. We now know that number is well over 100, that there is a real ripple effect. So anything that we can do as a society to decrease suicide helps many, many people. But yes, we believe that we've had hundreds of thousands of life-saving conversations.
And I think too, when we get angry, we see red, right? It's just, we don't think reasonably. And afterwards, we have that sober second thought and we think, why did I act that way? So our emotions can easily take over. And to actually think about dying, it may seem, well, that's the only alternative right now, but sometimes you need that time, you need that distance, but you also need an understanding ear. So when someone calls 988, they're not going to be told, oh, well, that's silly. You shouldn't even be thinking about that right now or anything like that. What is the experience someone can expect if they call 988 and they're already in a vulnerable position?
Right. Well, actually, your listeners might be interested to know what does happen. So you can call or text 988, and we were very purposeful about having a 3-digit number so that it is easy to remember. And we really want, that's our message this year, just in case. Remember that number. You might not be in a crisis now, but you may be in the future. We can all experience crises or be worried about someone else. So when you call or text 988, you get the option to have service in English or French. It's available 24/7. And then you are put through immediately to a live responder. And that person is trained to do exactly what you've just talked about, Kevin, to really to provide a non-judgmental space, to try to make a connection with you, an authentic connection with you, and to be able to manage and interact with people who can be very distressed. That's really not uncommon on 988 for people to have a whole range of emotional responses and ways that they express their distress. That comes in all forms, and
Mhm.
that's really part of what the responders do is to help contain that, understand that, and not be judgmental about it.
And that includes when it comes to issues like LGBTQ, things that people feel, oh, no one's going to understand me, but that's not the case.
Absolutely. So we know we live in we're very fortunate. We live in a very diverse country. People have all kinds of backgrounds and identities. And that's another thing our responders are trained in, to really have their own cultural humility and to be able to create spaces that are culturally responsive, culturally safe, and trauma informed, and to try to meet people where they're at, which includes understanding that people have diverse identities and needs, and to be accepting of those.
Tell me about your responders. Who am I talking to?
So the responders are a really very special group of people. First of all, responders come from all of our partner organizations. So we have 38 partners plus a central hub at CAMH that provide this service. And at those organizations, the responders are trained. They come from all different areas of Canada, all different backgrounds, but they are all trained to provide non-judgmental support and to do the intervention on 988. But they all have a commitment. That's, I think, part of what makes them a special group of people. It's a very vibrant group of people who feel very committed to providing that support. And I think we've always tried to, even in the way that the 988 service has been developed, we've really tried to emphasize being community-based and still being connected back to community. So callers and texters to 988 get support as close to home as possible, and they get responders who are working in those communities providing that support.
And we know that now, through the numbers, through stats, that youth are becoming, the stats on that is growing exponentially higher, and the age is getting lower. We talk about now 11-year-olds. There's been some rare cases even of children younger taking their own lives or having the suicidal ideations. Does it ever feel sometimes like you sort of have your finger in the dike, that you're trying to, it is just so overwhelming for people?
I mean, absolutely. We're also aware we're part of this society too, and have those concerns about suicidality, impacting people younger and younger. We do get calls from young people on our, like, through the phone or through the text, and we also recognize we are not the full solution to that distress. So very much we try to partner with other organizations and other resources, and really are very gratified that both provincial, territorial, and federal governments are investing in mental health more broadly, because absolutely a crisis line cannot be the only solution.
Yeah, let's talk about the solutions too. I mean, on TV, it takes 30 minutes, an hour to solve everything. And
Right.
we have that feeling like, oh, I never thought about that. Thank you very much. You have changed everything. This is not a miracle, but it's a start.
Yes. Well, we always say suicide prevention, it requires a whole of society approach. We need to, pay attention to, like, all ages and in many different contexts. So everyone has a role: schools, prisons, healthcare, but not just, a crisis line, family doctors, primary care providers, nurse practitioners. Sometimes those are the only point of contact that people have around their mental health and well-being. So it really is a collective whole of society approach that we need. Taxi drivers, Uber drivers, there are lots of people who have contact with people in states of crisis or distress.
Yeah, it could be someone who cuts your hair.
Yeah, absolutely.
That's kind of interesting. Would you encourage people? Let's say I'm a bartender, and there's a
Yes.
person who comes in, and I just sort of get
Yes.
that funny feeling.
Yes.
Is that
This is
is
why, yes.
that's a reason
Sorry.
for me to call you as the bartender?
Absolutely. If you are worried about someone, and that's why this year we're really with World Suicide Prevention Day coming up in early September, September the 10th, that is one of our key messages. Like, just in case you need to know this, know about 988. Know that number, save it, share it with others. And especially if you're in a role where you interface with a lot of people, you never know when that will be. So absolutely, we would like to reach any member of the public who might need the 988 number at any point.
Yeah, maybe you just carry around cards with you. You could print off
Yes.
the number and just sort of say, "Listen, you
Yes.
know what? And that's the thing is people that feel they're worried about having that awkward conversation, and we have
Mm-hmm.
learned years ago through research that it's okay to say the word suicide to someone
Absolutely.
who you feel might be having some ideations like that. It's not going to make them do it, but
Absolutely.
if it's that awkward conversation, sometimes it's just a matter of, you know what? It sounds to me like you could listen. You could have, you need an ear to listen to. So give this person a call. And we're used to, the 3 digits 911, and we're used to they
Right.
want you on and off that phone as quickly as possible. So it's like,
Right.
I got a fire at 223 Main Street. All right, thank you very much. We're on our way. But now it's a
Mm-hmm.
matter of you're not going to be rushed off the phone.
No, that's not one of our goals. Is not speed of getting people off of the service. We do have a goal of speed to answer, and we've been very effective at keeping that rate low. So people will usually only wait seconds to access someone, and that speed of answer is extremely important to us.
And I remember an emergency room doctor telling me years ago, saying that if someone comes in and I ask them what the matter is, and their first response is, I don't really know, that he says
Mm.
right away his first impression is, okay, this is probably going to be mental health related, anxiety related, and that. So it's okay to call
Mhm.
up and not know really why you're calling, just that you feel you're going to do something or you're thinking about doing something to yourself. And it's
Yeah.
okay just to simply say, I don't know. I wish I could describe it to you.
Yeah, absolutely. You don't need to have the words ready. It's okay. Our responders will help you find the words. It's really about feeling distress or feeling like you need support in that distress. And you were talking about having conversations. I think I just want to underscore what you said. There's no evidence that asking somebody if they're struggling with thoughts of whether they want to die or with suicide will push them in that direction. In fact, it's the opposite. It will pull them in and make them feel like they can speak to you.
Okay, so let's get the awareness out there. If I want
Mm-hmm.
to call you on the phone, I just simply pick up the phone anywhere,
Yeah.
and it could be a
Yeah.
payphone. I don't even know if payphones still
Oh,
exist. The few that are still out there.
what's a payphone?
I don't know. I heard my parents talking about it, um, but it would be free, just like 911 is, if there is a payphone. And but all you have to do is just 988,
Yeah. Pick it up, 988, and
ring, ring,
we'll
ring.
take it from there.
Yeah, and
Yes.
there
So
shouldn't be a
it
wait.
will. No, there are a couple of choices. There is a voice response that people get to let them know that they've landed in the right place, and then there are a couple of choices. Do you want service in English or French?
Mhm.
Are you under 18? And are you or are you First Nations, Inuit, and Métis, and would like service by Hope for Wellness? So you get three different button options, and
Mhm.
then once that happens, you're put right through. It should all take seconds.
You
Um,
can text as well,
yes, you don't need to find perfect words. Just and the responder will get the conversation started.
and
Yeah,
you
at
can go.
whatever pace feels right for the person calling.
And you this is not where they're tracing your call. And this is not, we're sending the police, anything like that.
Right. Well, so that is always, our responders use kind of the least intrusive means of providing support. We will intervene to stop a suicide that we think is imminent,
Is
or we think
active.
is the person is at imminent risk. But we work with that person. It's a very, very small percentage of calls or texts where there is emergency services involvement.
My guess, though, is that if someone does contact you, essentially they're asking for help.
Yes.
In that case.
Yes, and that's a kind of value that 988 holds, which is that we believe in life-saving intervention. We just know there's a lot we can do before engaging emergency services, which is one of the reasons that we exist as a service, to try to do everything that we can with you up until that point that we think we need to intervene. And that's only in 2% of interactions.
So the chances are there is someone out there right now who may just be overwhelmed and may feel this might be the answer. I want you to speak to them and encourage them to give you a try, at least.
Yes. We want to hear from you. We want to hear from you by phone or text, whichever is more comfortable to you, and you're deserving of support. We're here to have that conversation and to work with you because you have strengths that we can help you to remember and recognize, and that there is hope.
You bring up a very good point. When we feel that we just have no other choices, we sometimes can feel we're not worth it. We're not worthy of being validated. And we need to be reminded of that every once in a while. So 988.ca, Dr. Allison Crawford, Chief Medical Officer for the 988 Suicide Crisis Helpline. I wish you all the best, and I hope people spread the word 988 far and wide.
Thank you so much, Kevin. Really great to connect and get the word out there.
And that is this edition of the Mental Health Podcast. Until next time, thanks so much for joining us. And remember, take care of yourself and take care of each other.